ACMC portion of the show every other Tuesday. And we have Mike Habowski. Am I saying that right, Michael?
Yes, perfect.
President and CEO of ACMC. And Tina Staszewski?
Yes.
Did I get it, Tina?
Yes.
Vice President of Business Development at the hospital as well. And you guys were here a few months ago.
Yes.
Yeah.
And always a pleasure to have you on. I did get a little script here from our buddy Elaine, and said we're going to be talking about some different things at the hospital. First of all, I want to turn it over to you, Michael, and you kind of tell us a little bit about the hospital, and then we'll get into some other questions, if you would.
Sure. How
long have you been there?
It's 10 months now.
Is it 10 months?
Yes, I remember. It seems like yesterday, the first day that I was here and appeared on the show. This is my third time, and I really appreciate you having me back to tell about the good things that are happening at ACMC. And a lot has happened in those 10 months. One of our focuses, as you've heard previously here on this show, has been bringing physicians to the community. Physicians that are going to be active in our community, that are going to be here full-time, and are going to be here for our residents. And we've had a lot of success with that. We've talked about some of those physicians before. In fact, a few have been on your show recently. But if you don't mind, we can either go to your questions, or I could jump into what's going on with medical staff recruitment at ACMC.
Go right ahead. You know, I think the last one that really impressed me, it was his first time on the show, is Dr. Stevens.
Yes.
Wow.
He's unbelievable.
He was asking me my blood pressure.
Trying to recruit you as a patient.
Yeah, I'll tell you.
We'll take you.
And he gave me his card too. But I was so impressed with him. He was great. Very calm, very nice guy.
Yes, very knowledgeable, very experienced, and he's one of our 3 cardiologists at ACMC. We're very fortunate to have 2 of those cardiologists are Cleveland Clinic based, but Dr. Cho, who has been in the community for a long time and has been one of our anchors at ACMC, is still practicing at ACMC. So we have a nice combination of cardiology physicians, some new and some very established. So we appreciate that recognition. It has really raised the accessibility to our community for cardiology services. So he was first on my list to mention again. You also had Dr. Bibidakis on your show not too long ago, and he is our new general surgeon who was trained in the United States but born and lived over and worked in Greece for a while and is now back in the United States, and as we speak he is moving his family here, so we're very excited to him. He's well experienced, I believe 10 to 12 years of surgical experience. And we're very proud that he's here and chose ACMC in this community to be in, and he is here full time. He's been here for approximately 2 months now, I believe.
Yeah, he was on recently.
Yes.
And I was very impressed with him as well.
He got a quick start out of the gate in getting ingrained in the community and the activities, and he is going to continue to do that. And again, we have several other great general surgeons at ACMC with Dr. O'Brien and Dr. Patel, and now Dr. Bibidakis gives us our third full-time general surgeon. Dr. Bibidakis is a little bit unique too because he is general surgery but also well experienced in some broader surgeries, thoracic surgery being one of them, cancer surgery. So we're very excited that we could bring not just another physician to the community but more options for surgery, more types of surgery can now be done at ACMC instead of needing to leave the area for those surgeries. I'll keep going. I have 2 more.
Go right ahead.
2 more, and there's more to come. But Dr. Ashtabula, brand new pediatrician, coming to us. Born in India, but trained in New York at Flushing Hospital Medical Center in Flushing, New York. He has finally arrived. He's gotten a very great acceptance by the community. This gentleman was a chief resident. And so not only are we bringing new physicians, we're bringing highly qualified who have been in leadership positions in their previous jobs if they were established physicians, and even if they're new physicians, these are high profile, high quality physicians coming out of med school. So Dr. Ashtabula has joined our 3 other pediatrics. We have a large pediatric population at ACMC that we see, and we're very excited to have him here. Lastly, a big need at ACMC that has been filled has been our ear, nose, and throat, our ENT physician. And Dr. Papsadero has arrived and has gotten a very quick startup. We're looking today at the number of patients, and he's already, after a week or so, up to 20 patients a day with a backlog starting to grow. So he's been well accepted. Dr. Papsadero is well known throughout the Northeast Ohio area. At one point in his career, he led a 14-person, the largest ENT group in Northeast Ohio. And he has chosen to come to ACMC, and we're very proud to have him here. And I cannot tell you how good this is going to be for our community to have access to locally.
You know, I think he's scheduled for next week or the week after, I believe.
I know he's on soon.
Yes, because it was on the list that Elaine had sent me. So the last 2 doctors that you mentioned, I don't think have been on.
No, they're not.
Okay.
We're working with their schedules to get them on, though.
I can't believe he's got that many patients, and he's only been here a short period of time.
Big need in the community, yes.
Wow. Okay.
It's a nice fit with our large pediatric population that we see. It's a natural fit.
Was this in the plans, Mike, to recruit like this? I mean, you've brought a lot of new faces in.
Yes. We outlined in the first month, we worked with Tina as part of planning and development, and our entire administration team. We looked at the needs of the area. So the short answer, Chuck, is yes. Physician recruitment has been one of our top priorities and will continue to be one of our top priorities. And it's not just filling and bringing a physician to the community, it's bringing physicians that are going to ingrain themselves, they're going to be here. And Chuck, you've met these guys. These folks are nice people. They're not only great physicians, they're just, they have the right personality and just are great fits for our community.
Yeah, they're the regular guys.
Yes,
you know.
That's a good way to put it.
Can I interrupt for a second?
Yeah.
Let me just go back to cardiology. I know that Dr. Fleischer and Dr. Stevens, when they've been on, have talked about our cath lab. And what is important for the community to know is that our cath lab is a Cleveland Clinic cath lab. Which means that it follows the same protocols as the #1 heart program for 18 consecutive years in the country. That was just released by U.S. News and World Report, I believe, last week. So when you're choosing to have a diagnostic cardiac cath at ACMC, you are getting a catheterization that follows the same protocols as if you went to main campus Cleveland Clinic. And Dr. Stevens also spends 4 days at ACMC and 1 day a week down at main campus. So although our lab is diagnostic, if you are a patient who needed an intervention and you saw Dr. Stevens here, it's a very good likelihood that you would see him at main campus for that interventional treatment. So there's continuity of care as well.
I was going to ask you too, Tina, is Dr. Fleischer, is he based out of your hospital?
He's at ACMC 5 days a week.
5 days a week?
Yes.
And anybody, do you need a reference to get in to see these doctors?
That all depends on your individual insurance.
Okay.
Whether or not you need a referral from your primary care physician.
Okay. Okay.
But we can help you with that. They can call in directly, and we can work with the patients on that to see if they need that referral.
Yeah,
but
you can counsel them on that.
yes, most patients you do have direct access. But you know, I want to bring up one point too that we skipped on. I mean, the physicians we're bringing in too. I don't know if I emphasized it enough in going through it. Are full time here in the community. There's a lot of information out there on physicians in the community. We're blessed to have a lot of new physicians coming in, but these guys are here full time, and I think it's critical that our audience knows that having that full-time physician here is something that we are going to continue to strive to do.
Excellent, excellent. I know, how many physicians do you actually employ? Do you have an idea? Just a guesstimate.
How many we actually employ by the hospital or are on our staff altogether?
Altogether. Let's do that. It's kind of high, isn't it?
Yeah, there's a lot. Some have full-time privileges where they are there and very active. Others have courtesy privileges where they are coming in and doing some work, but not all their work. But altogether, I would say we have probably approximately 150 on staff. Active medical staff, which means you are there daily. You are doing a lot of work in the hospital. probably numbers in the 75 range, with actually 35 of those being employed by ACMC. That's a pretty large amount for a hospital of our size to have 35 employed physicians.
Sure.
Pretty impressive.
One question that I was asked to ask you, because they didn't understand it, didn't ACMC buy Premier Fitness? So you own...
Yes, we purchased Premier Fitness in October of 2009,
Okay.
and it was an opportunity for us to improve the health of our employees. We are self-insured, and we spend approximately $5 or $6 million a year on health insurance claims for our employees and their dependents. And we know that if you are healthier and you lead a healthier lifestyle, being overweight or obese is a main cause of many preventable illnesses.
Right.
So if we can have our employees be healthier, they are better able to take care of our patients. We substantially reduced the monthly membership fee to Premier for our employees to encourage them to join, and it's been successful so far. When we purchased Premier, we only had 23 employees who were members, and we're over 390
Is that
employees
right?
now. Yes.
My wife won I mentioned this before, not to you guys, but my wife won a contest where she got a year's Premier Fitness membership. 3 times a week she goes religiously. She's
Good.
lost 40 pounds.
See, it works.
It works, yeah.
It works.
So I mean, you know, and she comes home, and I mean, they put her through the workout and everything, and she's addicted to it now.
Yeah.
She won't miss it.
I just recently started working out with one of the personal trainers at Premier, and she works me.
You work up a sweat.
Yes, I thought I was in decent shape until after those personal training appointments, and yeah, I'm moving a little bit slower the next day, but it's all good.
Well, I'll tell you what. After about 2 months of this, we had to go up some steps down to the lake and up. And the next day, I couldn't hardly walk, and she was fine because she's doing the walking and all that stuff that you have there. She said it's a tremendous facility.
It is. It's a great opportunity for us.
Good.
And we left it open to the community as well because we feel a responsibility for the community to be healthy too.
Right.
And a lot of that is we don't want to just be there for you when you're sick. We want to help you lead a healthy lifestyle constantly.
Preventive maintenance.
Yes.
That helps out. What else you got going on there, Michael?
Well, we'll jump, I'm going to have one parting comment with our physicians, and then I'm going to jump into a whole new topic of electronic medical records. But I think the success that ACMC has had with physicians is a credit to our community. Good docs want to come here. When we recruit physicians and we interview them and they find out what's going on in the area, in the community, and at the hospital, they come away with a little bit of a wow factor. They said, we had no idea coming in how great a place ACMC is going to be for us to practice. So that's a credit to our community, our employees, and our existing medical staff. So I want to personally say thank you to all those audiences and to our community for just being an attractive place to bring new physicians.
I can't remember which doctor it was because I've interviewed so many from ACMC, but one of them actually impressed me with the fact that he just loves the countryside, the rural setting of the county.
Mm-hmm.
And again, I got to go back to the line where he just was one of the guys, and that was when it was refreshing.
Yes.
Didn't talk up and down at you.
Yes.
That was neat. I thought that was neat. Electronic medical records. What's
Yes.
that now?
Oh, gosh, we could talk a long time on that. So, this is our 1 month and 1 day anniversary. Back on June 23rd, ACMC implemented a full-blown, full-scope electronic medical record system. And in essence, what that was a lot of the patient's charts and records and test results that used to be kept on a paper have now been transferred into a computer system.
Okay.
And think of how that changes the world for our caregivers, our nurses, our doctors. We're
Huge.
used to writing everything
Yeah.
or dictating. You are now in a computer and doing everything by computer. I'm here to tell you we have had just an unbelievable successful implementation of this. We went up with our computer system in a terminology that's called the Big Bang. And what the Big Bang means, there's 2 options you have. you can start bringing up one little piece of the system at a time. Do one piece this month, one piece next month, and try to work it in slowly. When you do that, though, you're half in a paper world and you're half in a computer world. We made a decision to do everything at once electronically.
Just go for it then.
Just go for it. And our employees were on board. Our medical staff was very supportive, and we had a very successful implementation. We just got some statistics back that we measure, and 85% of all the orders that are being generated and all the work that's being done is now being done electronically, and that's only after 1 month. We've been recently notified by the Cleveland Clinic Health System that that is the best in the system.
Mike, now what's that mean for ACMC as far as, say if somebody has to go to Cleveland and they need the records right away, does that speed up the process?
Yes, you're ahead of me, but that's perfect. We are now not just at ACMC electronic, but we are now integrated with the Cleveland Clinic's Health System electronic medical records. So if you have had work done at one of the Cleveland Clinic hospitals or a Cleveland Clinic physician office that has electronic medical record, those results and that information is immediately available at the hospital through the computer.
Okay, that's amazing.
It is. It's so convenient. If you had lab work done somewhere at another hospital, your physician here in Ashtabula will be able to call that up on their computer and see that. Now we're expanding into the physician offices. That's our next phase for our employed physicians, but the hospital's taken care of now. We're still going through a little bit of growing pains, but all in all very good. And this will be better, faster, quicker patient care for everybody. So it's all about the quality of care. So.
For instance, and I'm just going to set an example. We're going to get this guy back here. He's a great guy, Dr. Chilcott.
Yes.
I love the guy. My wife loves him because that's her doctor. But there will come a time, if it's not already in place, where he could go through computer and get this information from you guys right at the main base hospital.
Yes.
Okay.
Or any hospital.
Or any
in the Cleveland Clinic Health System.
Go ahead, Tina.
He could also, as Mike said, it's not in our physician offices yet, but if Dr. Chilcott was looking for test results that were done at the hospital or a procedure that was done at the hospital, looking for those reports, he could log in. He could also do that from home if he needed to by a secure access.
Okay.
So if you have one of your specialists and they're on call, they may not need to come in if you've come into the emergency department, but they can look up your results and your previous treatment patterns and make a recommendation as to what needs to happen.
Okay.
And that makes it instantaneous.
Wow. Yeah, it's amazing how things have changed.
Yes.
It's unbelievable to have.
We used to have in the newspaper business. We just had filed and we did it by hand, and then when it went to computer, it just sped the process up and made it so much easier. At first it was kind of tough getting used to it, but after you get used to it big time.
It is, and we're still going through that, learning how to use it and getting accustomed to it, but it's been a tremendous success. Thanks to our people. Really, it's not about the millions of dollars you spent on hardware and software. It's the people, our employees, and our physicians who made this work.
Excellent, excellent. I just stumbled onto something here, Tina. Dr. Pappasadero. August 14th. It's going to be on the show.
Okay, great.
Yeah.
Okay, that's pretty soon.
Super. That's good. All right. Can we jump to patient experience?
Yes.
We do that.
I'm ready to go.
Okay, go for it.
So patient experience, we've talked about this before on the show, but along with physician recruitment, patient experience, and what does that mean? Patient experience is making sure that every patient who comes into our institution has the best experience possible. It's a given that the medical care needs to be good. We all expect that. But to have a great experience coming into the hospital is one of the major focuses that we are now embarking upon. And we know we have some work to do in this area a little bit, but we have spoken to our patients, we do surveys, our leaders and our managers do rounding throughout the hospital, and we take the comments from our patients and we are coming back now and implementing plans to make sure that when patients come to ACMC, whether you're an inpatient or an outpatient, that you have the best experience possible. It's a lot of work, and it's not just about nursing, it's about everybody from housekeeping, environmental services, to respiratory therapy, to nursing, to all our caregivers working together, focusing on our patients. We want every patient who leaves the ACMC to say, I had such a good experience there. This is my hospital. I want to come back. And we know we have some work to do with that, but we're going to make some great strides, and we are making some great strides in that area.
How do you do that, Mike? I mean, say if a person goes in there and you want to make sure that they feel comfortable. I'm sure it's probably number one on the list. Certainly everybody who goes to a hospital is probably nervous, and you want to make sure that they are calmed down and that sort of stuff. Is that what you're looking for?
Yeah, but to add, the short answer to how do you do that is, I think the number one answer needs to be, we have to make sure we're in constant communication with our patients. If we anticipate a lot of needs, but if a patient has a need, we have to have that communication so they can tell us, here's what I need to make sure my stay is great. So an example of that is we have increased what's called patient rounding. We have set a goal that at least every 2 hours, one of our caregivers will at least stop in, see the patient, say, hey, is everything going okay? Can I get anything for you?
Okay.
Just something that simple is very powerful in patients determining if they've had a good experience or not.
Okay.
Yeah, it's being proactive instead of waiting for the patient to ring their call light. It's the staff going in and kind of being preemptive or proactive, as we said, asking how their pain is. Because too often patients will wait until they're in extreme pain to say, I need my pain medication.
Okay.
But if we ask them in advance, we can stop that pain from getting to the point where it's almost unbearable. If we go in and we ask them if they need to use the restroom, or if they're a patient who can't get up and they need the bedpan, then they don't feel like they're waiting for very long when they've rung the call light. It's, as Mike said, it's anticipating and being proactive, and making the patients truly understand that we are there for them.
What, you have a little button on you that says it's my job.
Yes, we all are wearing an "It is my job" button, and it means that everything in the hospital is my job. I might be responsible, my job description may say that I do the business plans and the marketing and strategic planning and that sort of thing, but if I'm walking down the hall and I see a piece of paper on the floor, I pick it up and throw it out. If I'm up on the floors doing my rounding and there's a call light that's on, I go into the room and I ask the patient, how can I help you?
Okay.
And as long as it isn't something clinical, if they're just looking for a blanket,
Right.
or they need their water pitcher filled, although you do need to check with the nurse for that one because they may not be able to drink water right then and there, then I fulfill that need for them. If it's something I can't do as a non-clinical person, then I go and get that patient's nurse for them. But it's a sense of teamwork, that taking care of the patient and making that experience positive for them is everyone's responsibility, regardless of what your job title is or your job description says.
Good philosophy.
It is.
Very good philosophy.
Chuck, sometimes it's saying I'm sorry too with the communication, because we know sometimes there's times when you just haven't met the need of your patients, and patient experience also means sometimes saying, hey, we missed this one, and what do we need to do to make it better for you right now? So it's all about that communication.
Excellent. That communication is needed. It is needed in all businesses. 90 and 90.
Ah, yes. 90 and 90 is one of our initiatives that is going to help us focus again on better patient experience. We're doing this in collaboration with Cleveland Clinic. It's a system-wide initiative where they are rolling out tools to us. They're coming on site, and we're working closely with them to learn about some new tools, some new techniques on how to provide even a better patient experience than we are now. So that 90 and 90 means our goal, and this is a pretty aggressive goal, is that in 90 days we want to be at the 90th percentile, and that's a ranking, that's a percentage ranking as compared across the country. So 90th percentile means that we're doing better with our patient experience than 90% of the hospitals in the United States. It's a pretty aggressive goal, but it's one that we're going to meet.
That's very aggressive.
Very aggressive.
90, 3 months.
3 months.
And the challenge with that is that because it's a percentile ranking, the other hospitals across the country, if they improve their scores, we have to improve our scores to stay in that 90th percentile. So it's a moving target for us.
Okay.
It's not just meeting 90%. It means one month we might have to meet 91%, and next month we might have to meet 95% to stay in the 90th percentile.
I see. I see. Well, you got your work cut out there for you.
Yeah, well, we're very excited about it, and again, it's about administration alone can't make this happen. It's really about everybody working together as a team to make this happen and focused on our patients. And I just have a lot of confidence because we have the right people at ACMC, and I have a lot of confidence that we're going to be very successful with this.
Almost a year on the job, so
Yes.
how do you like this county?
I love it.
Yeah.
That's the short. I'm a person that's always worked in, I mentioned this before, in hospitals of similar size by choice, and I've had opportunity to go elsewhere, do other things, but I like getting to know the people. I like knowing the names of the people. I like the family feeling that you have at a hospital as ACMC. It's been good.
Have you been able to use
really good.
Have you been able to utilize the lake at all?
A little bit, not directly from Ashtabula, but I love the lake. I always make Tina come over. I know there's a couple different routes coming here. Tina, I said it this morning, I want to take the lake route again because it is, it's beautiful, but it's peaceful and mind clearing.
Yes.
As you drive out here from Ashtabula,
Yeah,
just
it
to
is.
see the beautiful lake and the weather. And I've done a little bit on the lake as far as with my family and kids. We do a little bit of kayaking.
Really?
And yeah, I was sore for about a week. I got to get over to Premier Health.
There you go.
And, with Tina. But it is, this is a beautiful area, and like I said, when physicians come here, I don't think they realize what is in this community for them. And when they get here, they get very excited about it.
Well, you know what? You luckily experienced a very mild winter here, and we're hoping we have another one next year.
I was all geared up with my four-wheel
Yeah,
drive,
right.
my new snow tires, and
And we didn't need to use them.
I called my wife at home, honey, it's sunny here in Ashtabula again in mid-December. Yeah,
It was amazing. It was amazing. Always a pleasure having you on, Mike and Tina. Come back again and see us soon and give us more updates. I think this is wonderful. The recruiting program you have undergoing is phenomenal. And I'm looking forward to the doctor on August 14th to stop by and tell us about ear, nose, and throat. I mean, as you said, that's very important, especially with all this heat and the sinuses and all the kind of problems that are going around.
Allergy season, yes.
I could have used them today.